there was an internal medicine rotation I had. So what the attending there would do, his thing, he seemed to enjoy humiliating the medical students. Like this was his thing. He was known for this. Like this wasn't just us.
Yeah.
So
like he had a fun hazing.
Oh, 100%,
like,
right?
Yeah.
And the thing is this in medicine, like any professional skill, right? The more you do it, the better you get at it usually.
Hopefully.
Right? And the more, hopefully, yeah, it's not always true, but,
not, I hope
but it could be true.
That.
and it feels easier to you. In other words, right, over time, I would take, it's just, I don't know, if you're trying to do basketball, right? You start off, you're shooting, you're not very good, right? You shoot several thousand shots a day or whatever it is, right?
Yeah.
Eventually, it's really easy for you to make that shot.
Yeah.
And then you look back at the 10-year-old who's you 15 years ago, right? And they stink, right?
Yeah.
And it'd be like going to them and being like, why can't you shoot, right? Like, I'm fantastic at this. Why aren't you fantastic at it, right?
Yeah, that's a good analogy, honestly. I've not thought about, medical school in that way, but yeah, for sure.
100%.
That's what you guys are learning new muscle memory.
You are, right? Because so the thing is that medicine, the practice of medicine is rapid sequence, for non-surgical specialties at least, it's rapid sequence pattern recognition, right? What it means is I have run through this iteration, right?
Yeah.
I've had X number of patients who've come in and told me this so many times that I now know what the pattern is. Right? I know that when you tell me this set of symptoms, odds are it's this, and if it's not that, it's this second thing, and if it's not that, it's this third thing, right? And we're going to work through this list based on highest statistical probability. Right. People may not articulate it in those terms, but that's actually what's going on, or what should be going on.
It's a flow chart, basically, within you, right?
It's a flow chart. You've internalized a flow chart, right? And you've internalized a set of rough probabilities. Right,
yeah. That you can do quickly as you could do it more.
Exactly, right? So when you start, it's like, every time they come in, right, you have to start from zero and be like, okay, all right, so they said they have chest pain. All right, now what causes chest pain again, right? Here's my list of things.
Look at all the possibilities, what's most probable. Go next.
Fast forward 15 years, right, if you tell me chest pain, right, I'm already asking, okay, I'm asking you a series of questions, right, rule this out, rule that out, check. We do all of that in 3 minutes. Right. Yeah. But that would have taken me an hour at the beginning, right?
And maybe not even knowing which questions
100%.
you needed to ask.
Well, it's because I was going to ask. I was going to ask you 100 questions, right? Because I didn't know how to target my questions. Medical students are notorious for this, right? They take an hour to do an admission interview, that the attending can do in 5 minutes, right?
Because of years of experience.
Because of years of experience, you know what to ask, you know how to cut it down quickly, right? What parts of information are irrelevant, you can filter those out.
And probably you know how to circle back if there's something that was missed of a question that could have been asked but was highly improbable. Right. To then when it's like, oh, now there's another piece of information or this didn't work, then you can quickly circle back to like, well, I would have asked this, but it was really low probability. What about it?
Right.
That makes sense.
You pull that out. Into this environment, though, and I think academia may be a little worse for this, but I couldn't speak to that 100%. What you have is this weird dynamic, right, where you have very experienced people trying to teach people that have no experience, right? And much less knowledge. And it's a setup for abuse.